The views expressed in this podcast do not reflect those of our training institutions or the APA. The information discussed is intended for educational purposes only and should not be used for diagnosis or treatment. Enjoy.
Hello, welcome to the American Journal of Psychiatry Resident Journal podcast. I'm Barrington Huang, one of the media editors. We've got Julian Raful, one of the journal reviewers.
Hello.
Again, this is for education, and neither Dr. Raful or I have any financial interest to disclose. We'd like to welcome our guest, Dr. Jonathan Helt. Dr. Helt is currently Associate Program Director of Residency Education at the UCLA Semel Institute for Neuroscience and Human Behavior at the VA site. He's a Southern California native and has spent much of his education and training in the California area. At UCLA, he serves on the inpatient psychiatry unit, in clinics, and in various levels of education. He also serves as a physician informaticist at the UCLA Health System, helping navigate the intersection between clinical work and the electronic medical record.
Thank you, Barrington, for sharing that with us. I don't think we can encapsulate the impact that Dr. Helt has had on others, including us as trainees, especially through the books that we're going to be discussing today: Memorable Psychiatry, Memorable Psychopharmacology, and Memorable Neurology. After having the steep learning curve going into intern year, I found these books very helpful for my learning. Dr. Helt, please tell us a little bit more about these books and how you first got interested in writing.
Hi, good morning. Thanks for having me on the podcast. So these books are intended to help medical students and other people trying to learn these areas. And it's really aimed at kind of a middle level, not something that's so basic that you don't really feel like you get a lot out of it, but nothing so high level that it's very complicated with entire receptor profiles and things like that. I feel like for me, my interest in this area really came from when I was a medical student, when I was looking for something pitched at that level and didn't really find much. I felt like everything had a learning curve that was either too shallow or too steep, and I wanted to create something to help bridge that gap. So this didn't actually start out as a project to write books. They started out as a project to make lectures and notes. I did this during my fourth year of medical school and ended up publishing the lectures that I made on YouTube. It was important to me that the lectures were freely available to anybody who wanted to learn them, and that's something that I've tried to keep moving forward as well. So I haven't monetized the videos or anything like that. I want to make sure that anyone who wants to learn from them has access to it. In terms of translating those lectures into book form, this actually came when I was a resident, when I was doing a lot of these lectures for the medical students who are on service with me. And a lot of them had asked if I had written this down anywhere, if that was available. And that was kind of where I got the idea to consider putting this into book form, which I did as a third year resident.
Oh, wow, that's very interesting. So you started actually with the idea of these books from your fourth year of medical school.
At least the idea for the content, the idea for turning them into books didn't come until later on when I was a resident.
Okay. And did you find the time that it took to put these lectures into written form to be very consuming, or was it a seamless process because you've had so much material going into them?
For the psychopharm book, it was pretty seamless. I'm not great at kind of speaking off the cuff, so for all of my lectures, I actually basically mapped out a script for each and every slide, exactly what I would say. So for the psychopharm lectures, it was basically a process of taking that script out of PowerPoint and putting it into a Microsoft Word document and then formatting it, adding pictures, adding practice questions, that sort of thing. So for the psychopharm book, it was actually a fairly easy process because most of the material was mapped out in advance. For the psychiatric diagnosis book and the neuroscience book, that one was much more starting from scratch, and that took a lot more upfront investment.
Seems like there's a multi-year process. Could you talk a little bit more about your time management and how are you able to see those projects to come to fruition?
Yeah, I think there was a bit of a gap for sure between when I first started working on the lectures in med school and when I started translating them into books. Largely, that's just because intern year and second year are pretty clinically heavy, and I honestly didn't have a lot of time to focus on a whole lot else. I'm lucky in that the residency program that I trained at, like the third and the fourth year, aren't quite as heavy as the first two. So I had a little bit more time. I was able to have, 4 to 8 hours per week to devote towards educational or scholarly pursuits. And I put a lot of that time towards these books. So each book there's probably a gap of about a year a year to year and a half between each one. And part of that was just taking a break and not sitting at my computer in front of a blank Word document for a few months. A lot of that was just putting together some of the research that I wanted to do and finding some of the articles that I wanted to cite, that sort of thing. So the time management was definitely challenging trying to do it during the work week. And I ended up spending a lot of weekend mornings just kind of on a beanbag couch with my laptop open working on the book. But it wasn't too bad, although I was certainly happy to be done with each book after they were published.
And I know you mentioned in some of your books, I know Dr. DeBonis and many others, you talk about some of the contributions that other people helped in your path?
Yeah, I'd say probably the first person to really kind of put that faith in me and to really make me feel like I could contribute in this way was Dr. Randall at Loma Linda, where I was a medical student. I worked with him on a rotation, and he told me that he was interested in helping to develop some educational materials for the residents and med students that he was working with. And so he basically set up an arrangement where I would kind of help to create some of these PowerPoints that he would then use. And the feedback that he gave me and the support that he gave me through that process made me feel it kind of got rid of a bit of that imposter syndrome that I think a lot of us have when we're first going into medicine and teaching. And it helped me to gain that confidence. Working with Dr. DeBonis in residency, she was one of the people who really kind of took a close look at the things that I was writing and gave very substantial, helpful feedback on it. A lot of the information in the Psychopharm book on pathways and neurotransmitters, that came directly from her because she had a good vantage point into what was important for medical students through her role as the neuroscience block chair for the second year medical students. And so she was able to say, here's what's important, make sure to include something on this. And that was something I really appreciated, to get a second set of eyes on that.
Wow, that's excellent. It's nice to hear that you had excellent mentoring throughout this time to help you bring these books to fruition.
Oh, definitely.
Really enjoyed reading through the books, and I've also enjoyed the humor that is imbued into the textbooks. Lots of great acronyms to serve as memory aids. How did you sit and find the humor? How did you incorporate the humor into the material? And did you ever find pushback when you would some humor that might be a little colorful or a little bit, outside the conservative, thought process of what people consider medicine to be?
In terms of coming up with them, some of them I did find through either online. There was actually this book that I used, like a PDF that I used in medical school that was somewhat tongue-in-cheek called Last Aid instead of First Aid, which a lot of people are familiar with. And that kind of got me used to the idea of like making mnemonics, even if they were potentially a little bit off-color. A lot of the mnemonics I either found or I came up with myself, and sometimes it was as simple of a process as sitting down with like 8 letters that I needed to put together and trying to make a word out of it, almost like playing a reverse game of Scrabble. So that was a process that I used a lot. I think growing up, I always made a lot of puns and wordplay, and some of them came fairly quickly to me, and others I took a few hours to put together. So it was really a variable process, but it was something that I found enjoyable, and there was definitely kind of like a dopamine rush trying to get there. And when I actually found a mnemonic that works, it was really rewarding. In terms of any sort of pushback, so I have the lectures on YouTube, and the YouTube comment section is one of the more interesting places on the internet for sure. And I'll get a lot of that immediate feedback in terms of whether people find a joke appropriate or not. And I have changed a few of the mnemonics in response to that. But overall, I think I haven't actually gotten as much pushback as I thought that I would. There's been maybe a handful of ones that I felt were worthwhile to change. But for the most part, I think people understand that the goal here is not to be offensive. It's not to be stigmatizing. The goal is really to help people remember this information so that they can then use that to help patients, which I'm hoping is something that we can all agree is a good thing.
Mm-hmm. Definitely, I found them to be quite refreshing to have some humor imbued throughout the text. I wanted to ask too, when you were younger and maybe an undergrad, did you have creative writing background or have any writing experience that you felt was helpful during this, or was this your first real attempt at writing anything?
Honestly, no, I don't really have any clear background in writing other than taking, English 101 and 102 in college like most people did. I think when I was much younger, when I was in elementary school, I my goal was to be a writer at that point. And that somewhat fell away over the years. And I kind of saw this as an opportunity to try to get back into that and develop that skill again. So no real writing ability or experience before this. And I think that's something where having this come initially from like narrations of lectures really helped. I didn't really think of it as writing. I thought of it more as, what would I say if I were speaking this? And in my mind, that actually helped the writing to become a lot more clear and concise than a lot of the more academic works out there.
Actually, that's a very helpful technique, because currently Barrington and I are working on commentaries or any submissions to the residence journal, and we often wonder, how do you really start? So the idea of thinking how you would speak it before you write it is actually very helpful to maybe overcome a little nerve or anxiety regarding writing down the material that you want to put down. So thank you for that. I think some of our listeners would appreciate it.
Yeah, it certainly helped me.
Publishing process just seems very daunting for people earlier in their careers. Could you talk a little bit more about how that was with the publishing company or any other interactions you had surrounding that?
I think the publishing process was actually not as bad as I thought it was going to be. I looked into both more traditional publishing through a publishing house as well as self-publishing. And for a while, I was strongly considering going the traditional publishing route. But I ultimately decided on self-publishing due to the greater creative control that it gave me. So I ended up using a service called CreateSpace, which has since been rebranded as Amazon Kindle Direct. And essentially, with Amazon Kindle Direct, there's no publisher that you're going through. You basically do everything yourself. They give you a template to follow, and as long as what you've written fits into that template, you can publish it. So the process was actually pretty easy. I uploaded my manuscript. I did find somebody who was going to help design the cover. I have absolutely no design ability. So that was something that I thought was worth outsourcing, just because for a lot of people, the cover is the first thing that they see, and it's their point of deciding whether or not they're going to pick up the book. So that was one where I did enlist the help of somebody else. But with those two things, with the cover and the manuscript, you upload it. Amazon does a quick check to make sure that there's no major formatting errors. And from there, you're able to release it directly. So I think that the bar to publishing now with options like Amazon Kindle Direct is much, much lower than it's been in the past. I'd say it's somewhat similar to if you want to start like a TV series, or if you want to put something out there with YouTube, you can just publish it directly. And it's very similar with Amazon Kindle Direct, where there's not really a barrier or anybody holding you back from putting what you want out there into the world. So overall, I've been very happy with the publishing process. It's very easy to make changes. I haven't been perfect with editing, and I've actually been working with my sister, who's a very detail-oriented editor, to help find some of the errors that I've made, and we are able to release those updates and changes basically instantaneously. Sorry, that was my...
Oh, yeah,
that was my cat feeder. Okay.
What kind of cat do you have?
I have two. They're sisters. They're tortoiseshell cats.
Oh, cute.
The actual printing of the textbook, how did that come about?
So the printing is a very easy process as well. With the service that I use, it's a print-on-demand service. So it's not like I have to order a certain amount of copies that are then sitting in a warehouse somewhere. Amazon Kindle Direct has the ability to print these books on demand as long as they have the cover and the manuscript files, which makes it much, much more convenient, because you're not committing to printing a certain amount that may or may not sell. So that process using the service that I do is actually very, very easy.
Oh, that's very interesting.
Mm-hmm. Yeah.
I guess I was wondering, when we think about publishing, at least in medical school and a residency, we traditionally think about research articles, but I guess this kind of sheds a different light. I don't know if you had ever thought about that in med school, or if there was other things that you pursued in med school.
The summer before I started med school, and then I actually took a year off between first and second year of med school to do research. So I got a few publications out of that time. That was in the field of urology. I was looking at things like kidney transplants or prostate cancer. And I think that was actually a really good experience, but to me, it feels very different than writing these sorts of medical education textbooks. Like it feels like a completely different skill set, even though I'm sure that there's some overlap. And that's something that I'm hoping to continue now, probably more in the field of psychiatry, obviously, to keep trying to publish and contribute to the literature in that way. In my mind, this feels like kind of a different process, though.
Yeah, that's also a nice point that you've made regarding writing as a researcher versus writing as an educator. So in that mindset, are you pursuing future editions of these books or pursuing other topics that you're wanting to pursue medical education series on?
Yeah, I think my goal right now is to start working on future editions for each of these books. I think I'm just about out of topics that I could cover with any reasonable claim to being not even an expert, but having any sort of background on these. Even the last book I published, the neurology book, was probably technically a little bit out of my wheelhouse, but I tried to use that to my advantage by saying that like I'm absolutely not an expert in clinical neurology or neuroscience, but hopefully the book is framed in such a way that it gets the basics across to other people who potentially may have struggled with learning this topic as well. So yeah, I definitely think I probably reached the limit in terms of topics that I can cover. So my goal now is to start going back through each of the 3 books and trying to make updates.
I'm a big fan of medical education, and I know that sometimes you can scan the internet and find some textbooks. I found a book that you may have seen. It's called Brain Calipers. It's the mental status exam. Do you have any thoughts on maybe putting together a memorable mental status exam textbook?
Yeah, I haven't heard of that particular book, but I'll definitely check it out. In terms of putting together the mental status exam textbook, I guess my sense of it is just trying to decide where these books are pitched at. And I definitely view them as being pitched at kind of late medical school, like when somebody's in their clerkships or early internship or residency, kind of right at that level, where a full book devoted to mental status exam, I would think might be more in the once you are a psychiatry resident, like fully kind of devoted to this as your field of study. So I think it might be an area worth exploring, but it would probably be a step up in terms of level of detail, the target audience compared with the books that I published so far.
So I know we've talked about a lot of things. I know your books are geared at people early in their psychiatry career or about to start their residency. For our listeners who may be in that situation, do you have any advice to give to them?
I would say probably first and foremost, any advice I would give to somebody starting off in the field of psychiatry is just not to lose your curiosity. I think for me, part of what makes psychiatry so interesting and rewarding is that it's so rich in detail and meaning. And it can be really tempting when first learning the information to try to reduce things down to just checklists or just memorize criteria for each of the disorders. And for me, this is a really quick way to lose sight of why psychiatry is such a compelling field in the first place. It really is one of the most nuanced and ambiguous and ultimately probably the most human of all medical subspecialties. So I would say don't lose your curiosity. Always look for those wrinkles, those details, those things that make the field worth studying. I'm hoping that my books don't help to reinforce that by having a focus on using mnemonics to learn some of the diagnostic criteria. I really hope that it's pitched in such a way that you get that information first, you get that information down quickly with the mnemonics, and then you can start to learn the richness from there. But yeah, that would be really what I would say to anybody starting out is don't lose that sense of curiosity, because I really do think that that's what separates a good psychiatrist from a great one, is that interest in always trying to learn more and always trying to look further.
Thanks for sharing that. You mentioned a little earlier that you're interested in urology a little bit, and obviously now you're a psychiatrist. Were there any moments in medical school that sparked that curiosity to go into psychiatry?
Yeah, I would say it largely came out of my clinical experiences. I think I ended up doing research in the Department of Urology through a personal connection. It wasn't something that necessarily grabbed my interest that strongly. And for a while, I actually thought that I was going to not continue in medicine. So I mentioned that I took a year off between first and second year of medical school. And that was because at that point, basically all of the clinical experiences that I'd had didn't feel like they gelled with me. It was things like working in the ICU or working in the ER, where it was very procedurally based or wasn't really based on human interaction too much. And so for a while, I was considering potentially dropping out of medicine to do other things. And this is an area where once I got back to third year and I was able to see other fields of medicine that were a little bit more patient focused, that's what helped to kind of spark my interest in psychiatry. That was the area where I felt like I could spend the most time with patients. I remember being on my third year clerkship and rounds didn't start until 10:30 and I got there at 8. So I had 2.5 hours where I could just sit with the patients on the unit and talk with them and get to know their lives and their stories. So I think for me, that's what really put psychiatry over and above all the other fields of medicine, and it really helped to convince me that this was the right field for me.
That is a very inspirational thing to disclose. Thank you very much. I'm sure some listeners may have questions regarding specialty choice or whether medical school or medicine is right for them. So I appreciate that candor. It's very helpful.
No, yeah, absolutely.
Do you have any other final thoughts for us right now, or anything else you wanted to share?
I just wanted to say thank you again for taking the time out to have me on the podcast. And I really appreciate the openness that you've had towards featuring me. So I appreciate that. Thank you.
I wanted to thank you as well for social media for Dr. Helt's books and YouTube channel. You can check it out at memorablepsych.com/books. And you can check out the YouTube channel at memorablepsych.com/videos. And both of those are accessible straight from the memorablepsych.com website as well. I think, Dr. Helt, your impact is invaluable. We appreciate you listeners as well for listening to the American Journal of Psychiatry Resident Journal podcast. If you have any suggestions or topics you'd like us to see, come interact with us on social media. We have Facebook at AJP Residence Journal, Instagram at AJP Residence Journal, Twitter at AJP_Res Journal, and YouTube with the American Journal of Psychiatry Resident Journal. And go ahead and click subscribe as well if you liked our episode. We look forward to tuning in next time.
Thank you, Dr. Helt.
Thank you.
We appreciate your time.